And still with Morning Live, thank you so much for being with us. Now, as we've been reporting in the news this morning, South Africa wakes up to news that 50 more people have died of COVID-19 related conditions in the country. And this takes the overall death toll in the country to 755. A total of 35,812 people have tested positive for COVID-19 to date. The Eastern Cape has now overtaken Gauteng, as we heard in the news there with Leanne, with the second highest number of infections, while the Western Cape remains the epicentre with more than 23,500 confirmed cases. So to help us better understand the numbers and to give an update on the country's fight against the pandemic, we are joined now via Skype by the Health Minister, Dr. Zweli Mkhize. Dr. Mkhize, good to have you on the show again. Welcome to Morning Live.
Good morning, Sakina, and to all the viewers.
Minister Mkhize, if I could perhaps just start by getting your reaction to the court judgment yesterday regarding the regulations governing lockdowns level 3 and 4. The court saying that those regulations are unconstitutional and saying essentially some of them are irrational. What's your initial reaction to that?
Well, in the first instance, I think we should accept that the court has the jurisdiction to rule on those matters. And secondly, that the nature of the issues raised relate to a number of issues of interpretation. And so I believe that from the Department of Health, but for the rest of the government, we will be studying, but we also need to probably look at whether we can appeal or how we can get them rectified. What I think was good is that there is a period of 14 days, which has been made available for us to try and correct the situation. So we need to focus on that. In some areas, I think there may well be a basis for what the judge has raised, but in other areas, we might also think that there may be interpretation issues where the basis of the infection and the restrictions may not have been properly clarified. So we have to look at the totality of the issue and therefore see how we can deal with it. All in all, everything that has been done in order to try and assist in the containment of the infection, and where we think that it needs to be clarified properly, it needs to be done, but also where we think that there needs to be changes in the approach, we need to consider that.
So, Minister, what has the effect of the lockdown been in terms of the regulations thus far and the infection rate in South Africa? Has it been successful?
In general terms, let me say that the lockdown was actually pretty successful. In terms of our own quantification of the nature of the infection, we found that the doubling time of the infection at the time it started was about 2 days, but later on that actually was, after the lockdown, was decreased to be about 15 days for doubling time. So the other issue was that we were able to see that the trajectory of the infection changed and it became a bit flatter. And so if you were to compare the rest of the country and what's happening in the Western Cape, it's the Western Cape where things went really, a bit more out of control. The rest of the country had actually stabilized in terms of how the rate of infection was showing. But the Western Cape, we've looked at what happened there, and we're trying to find mechanisms to try and contain it in the way it is going. Firstly, what we think had happened in the Western Cape, because all we started with was imported cases which came from abroad, and that we were able to stop. Now, when we're dealing with the internal transmission in the Western Cape, we started experiencing what we call the cluster outbreaks, where several people are found to be infected in one area, and yet because this was associated with a workplace, later on the same people would then go to the villages or townships or suburbs and therefore spread the infection in various areas. So by the time you detect it, it's actually seeped into the whole community and spread much further. So that is what has happened. So you'll notice that at this point, almost two-thirds, 65% of the positive cases are in the Western Cape, and that indicates that that's really where the epicenter is. Now, there's a trend now that's already showing, because of the proximity to the Eastern Cape and the interrelationship within the communities on both sides of the boundary of the two provinces. The numbers are now slowly increasing in the Eastern Cape. So there is a pattern now which has spread into the Eastern Cape that we have to be focusing on. So our approach is that we have to really deal with the epicenter in the Western Cape and in the Eastern Cape. But the rest of the other parts have got also hotspots, which we call the high transmission areas in various metros. And these are going to behave in the same way that we are seeing in the Western Cape unless we find ways to intervene at that level, particularly in KwaZulu-Natal and Gauteng.
Now, Minister, when you say things were out of control in the Western Cape, are they now under control? And what does that mean in terms of those cluster outbreaks that you mentioned? Because if, as you state, initially these infections was a result of people who had come into the country from elsewhere, and we know that Cape Town in particular is a tourism hotspot, in terms of the results that we're seeing now, is that still indicative of what happened at the very beginning? Because we're almost on to day 70, day 69 to be exact, of the nationwide lockdown.
Well, the reality is that outside China, most of the infection almost arose in the same way. The first cases were imported from somewhere else, and then thereafter you got what we call the internal transmission, where local people have got no history of travel, spread it up amongst themselves. Now, this is the most difficult part, which has happened in the whole world, because the transmission happens without us being able to detect that it is spreading until you start testing. In this case, in the Western Cape, it happened in areas where, these clusters happened in areas which during the lockdown were allowed to continue operating. So it was people who were working in the retail shops, who were working in the factories for food processing factories and medicine manufacturing factories. So by right, those people were actually expected to be working. So you didn't expect them to be under a lockdown. But at that time, we had not started really seriously doing distancing, social distancing and masks and so on. So when we actually picked up the infection, it had actually spread quite a bit. Now that it's gone into the rest of the community, the major issue that we're focusing on now is really intensifying the identification, detection, and testing of people, and then ensure that those who are positive are taken to isolation. Those who are contacts must be taken to further quarantine until we can move away people who have a potential to spread the infection amongst the community, so that 14 days they're away from the area of the community as such. So that's where we're focusing on. And part of what we thought was a challenge here has been the numbers of people who are in areas where people can't isolate in their own home. So we've now brought in the whole idea of additional accommodation, which is going to assist in this way. So all the ministers, like Minister of Public Works, Minister of Defense, Minister of Police and Tourism and Environment, all of us are now looking for additional ways of increasing the numbers of beds, which can actually help, because the numbers have increased pretty fast. So we will be doing that as we speak now to help the province to be able to isolate people and so on. If we take that approach, in addition to the numbers of the specialist health experts that we brought in, the epidemiologists, family practitioners, and other public health specialists, that means now once we've divided the province up into sub-districts, you will then be able to have a concentrated approach to those areas that require the isolation of people who are infected. So that's really the emphasis that we're making at this point. And we have been around to see that both from the point of view of containment, that we are able to support the provincial and district municipalities, as well as ensure that on the case management side, the numbers of beds to take the people out to make sure that they can get treatment, all of that is being emphasized upon. So that's really the strategy that we're working on. It's going to make an effect once all of those steps have also all been properly implemented.
Minister, you've been in the Western Cape this week, and as you said, these cluster outbreaks seem to emanate from the workplace that is then taken back into the community that leads to the local transmissions within those communities. Are you satisfied with what you've seen, and do you believe that enough is being done in the Western Cape to minimize infections, especially in the workplace? Are people adhering to the regulations?
Well, I think the numbers are showing that we need to do more to support the province, as well as the district areas. In this case, we have walked around to look at what is being done. You can see that there's an effort to try and contain the infection. So there are areas where there have already been some good outcomes that are showing. For example, the area of Witzenberg, where I've been in the Ceres Valley, where the first infections really started raging in the farming community. There you could see that there's been a lot of working together in the district council and NGOs and the farming community and the community in general. So you can see that they've managed to contain the numbers from 253. They've only got about 39 that are positive at this point, which are active cases. The rest of the others, they've used a lot of education and training to contain the situation. But in the nearby areas such as Drakensberg, the numbers are still increasing. Then if you come into the metro, Tygerberg, Khayelitsha, and a lot of those areas are still showing the numbers that are increasing, which means that's really where we need to focus our attention to. So I would say that if there's anything that needs to be done is to ensure that we strengthen the capacity of the province to deal with the containment, the issue of isolation and quarantine. That, as we were discussing, I was quite able to see that effort is being put in, but we need more effort on that side. Then on the area of increasing the numbers of beds, because the numbers of people who are positive has increased, that means now we found more beds are now needed. So we then have to make an additional effort to balance up the needs for the beds. So whilst these other beds are being completed, which is what we call the field hospitals, in the city ICC, in the warehouses that have been converted, all of that is now going to be bolstered by getting additional beds in the private sector. So last night I convened a meeting of all the private hospitals, all the specialist groups, all the general practitioner groups and laboratories and everybody. Together, we've made an undertaking that all the people who need beds, if there's a shortage in the government, in the public sector, they will be taken onto the private sector. We'll put the terms very clearly. We'll put all the tariffs on the table. And so every area where they need beds and they have not enough beds in the public sector, no patient will be stranded. And the treatment will be the same based on a protocol so that no patient will be treated differently because they are coming from a public sector. So all of that is the ways of how we deal with it. In terms of the case management and the protocol, there's nothing to worry about there in terms of the specialists, the family physicians, the infectious disease specialists, the pulmonologists, intensive care specialists. All of them are very well qualified to be able to deal with the issue once someone gets into the hospital. So we are working very closely to identify whatever challenges that they face, and then we must make sure that we get those sorted out. My major concern at this point is to make sure that we can get beds from the private sector for quarantine. The people who are well but are associated with positive cases need to be taken out from the community, and therefore they need to be given space so that they can show whether there were symptoms or not. And those who are positive cases also need to be taken to isolation so that they don't spread the infection. If we keep this balance and then make sure that out there in the community, everybody understands there's a need to change behavior. Everyone must wear a mask when you get out of the house. They must wash their hands frequently, use hand sanitizers, and keep a distance. Whether it's at workplace or it's in a social setting, the numbers must not be very high of people who are working together. So all of these are things that we have to deal with using workplace protocols. Everyone has to comply to that.
Minister, with regard to the backlog in results of testing, now we saw the Eastern Cape overtaking Gauteng, now coming in as the province with the second highest number of positive cases of COVID-19. But we also saw the Eastern Cape legislature was informed that they have a 3-week backlog in terms of those results. What does it mean, those results that your department issues every night? From when are those results? What exactly are we looking at in terms of those numbers?
Well, let me just say, we have done over 760,000 tests. By all manner of comparison, that's a very huge number. Then in the system, you don't test everybody necessarily every day. There will be some who will not be done on the same day. They'll spill over. And when they spill over, we'll call that a backlog. But that backlog exists every now and again, depending on what the constraints we get. So from the very first few weeks, we experience backlogs and would clear them. And then it would take a number of days, and then would clear them. In this case, we have a situation where we increase the testing from the community screening. We increase the testing from the patients who are being admitted in the hospitals. And because of that, we started seeing that the numbers were increasing to be higher than the amount of tests that we can do in a day, mainly because from various countries, the number of kits have actually been not increasing in keeping with our requirements. So because that is a problem globally, we have to solve the problem of sourcing the kits. So in reality, we would want to clear the backlog. And when we look at the backlog, it doesn't really affect a lot of issues, except that we do want to make sure that as many people get tested as possible. So when we looked at the numbers, I don't have a day or two's number, but 3 or so days ago, the figure would have been around 80,000. And that means that there are people that might not have been receiving the results immediately. Now, we've got a way around on how we manage that. Firstly, we are looking for additional kits, and we can give you a number of possibilities of how we think we're going to get that. So we think that the backlog is a temporary problem that we will solve in a matter of the next coming days. So that's one issue. The second issue is that the treatment of the patients, we have agreed on an approach that does not compromise anybody's treatment. So, for example, the people whose tests we prioritize are those where the doctor needs the treatment immediately to be able to decide on the management of the patient. Those people don't get affected at all, because then we have reorganized the prioritization of all the tests. So it's what we therefore would call a prioritization at that level. The next angle becomes those that we have done tests from the community just to be able to work out whether there's infection or not. And that is based on clinical symptoms that we elicit in some of the people. So we've actually said that if we can focus on the number of people that get tested, and then make sure that they are managed clinically. If they've got symptoms, then of course you have to keep them for 14 days until they are better. And after 14 days, you can actually discharge them even before the results come back, because of the way we've understood the spread of the infection. And on the other side, if there were people who were on quarantine because they were contacts, if they develop symptoms, you can triage them and take them for treatment. If they don't develop symptoms and you've got 14 days, then of course your period of mandatory quarantine is over, so the people can be taken home. And so all of that reduces the problem of people who will spread the infection whilst they're positive, or whilst they are positive. So we will then, because we've got new teams that are coming on to deal with intensive interventions, we're now going to be going out to look for people with comorbidities. These are people who have got other diseases that we have seen that are associated with mortality. So blood pressures, heart diseases, chest infections or chest diseases or pulmonary diseases, as well as diabetes and cancers. Now, the areas which are subdivided, the teams are going to go and look out for all those people and test them and make them priority. So we are actually very targeted about it. Whilst we're still dealing with the backlog, we'll not get anybody's care compromised, and we'll make sure that those who need to be isolated will still be given the mandatory period of isolation and quarantine so that they can manage the issue. Our major issue in the Western Cape is to make sure that for every sub-district that we have divided, we've got dedicated beds for isolation of those patients. We've got dedicated beds for the contacts in that particular area to be quarantined. That's what we need to make sure we intensify. If we intensify it that way, we'll actually be able to see the numbers change from what we are seeing now.
And there are, of course, questions, Minister, around given the population size of a province like Gauteng, why are we seeing fewer infections, as it were, as per the numbers right now, and also fewer deaths in Gauteng as compared to other provinces like the Western Cape, KwaZulu-Natal, the Eastern Cape? What is Gauteng doing that perhaps the other provinces are not?
Well, the relationship to the numbers of people, of positive cases and the mortality figures would be subject of research that specialists in the field will be able to say to us what they thought were the real reasons for that. So we wouldn't be able to explain that. However, whilst we're busy dealing with that issue, we are focusing on the fact that in the early days, the major issue was to try and match the numbers of positive cases with the numbers of contacts that are identified. And as soon as those contacts are identified, then the reaching those contacts and putting them onto quarantine was a major step, which was very, very important at that time. And for every case that we find, that approach is still very, very important. Now, in the Gauteng and KwaZulu-Natal and the Free State, because again, in the Free State, the infection was raging earlier on and it got contained. So that number was quickly matched so that you had more of the people who were identified as contacts all being contained, and they were contacted. And so that actually was very successful at that level. In the Eastern Cape and the Western Cape, that lagged a bit behind. And therefore, that's one of the issues that we think is a cause of the spread of the pattern. But we need to therefore say that once we have eased the restrictions, the chances are that the numbers of clusters are going to start showing up in other provinces because of the movement of people. We've already seen that in Limpopo, for example, the numbers have started increasing. In Northwest, the same thing. So in every province, because of the opening up, the numbers will start increasing. The approach we took, as the president had announced, is what we call a differentiated approach, which basically says we identify the areas as having low transmission, and that we therefore try and detect early and contain the spread in those areas. And then in the areas which we call hotspots, we then need to put intensive interventions to be able to deal with it. But most important now is going to be the emphasis on multi-sectoral teams where the local community leaders, the church leaders, traditional leaders, NGOs, neighborhood watch, community police forums, ward committees, and community structures, together with the ward councillors, members of parliament, and members of provincial and national parliaments. Everybody works together to emphasize the need for behavioral change, where even in the workplaces, the business, everyone knows we have to make sure that every day you screen people for symptoms, and those who have got symptoms that are suggestive of any infection should therefore not come into the workplace. That's a new way of how we're going to live, and that's the area we need to focus and emphasize on.
And with regard to the accuracy in our testing, Minister, speaking of, the workplace and everybody comes in, they get screened every morning. Are we also having those discussions as we see in other countries where there are now questions? I mean, the SABC, for example, one of our colleagues in KwaZulu-Natal was given results that said that he was COVID positive. The entire office closed down, and only to come back and say, well, actually, you were negative. So how accurate are our testing methods at this point?
By and large, our tests are accurate. we can never exclude a possibility of a mistake, but it will be very few instances where you would pick up what we would call a mistake. And in the past, when we were starting the treatment program and so the testing program, we used to have alternative ways of verification until everybody got into the habit of understanding how the testing gets to be done. So we don't now get a lot of those mistakes. Now, with that, if we suspect that there's any mistake in a situation, we have to then investigate and check where was the mistake. A few times in the past, we used to investigate and check. We've been able to resolve some of those issues that caused the mistakes in the past. Now, in the case of what happened in Durban, we have actually said that the provincial government must send people to actually investigate that case and check what has happened. What we need to be very careful about is that it's a mistake that's been recorded. When they discovered it, they came back and corrected it. So if the mistake happens, people need to come back and say, no, there was a mistake, and explain why there was a mistake, how it happened, and how to make sure it doesn't happen again. We have not had those many reports coming from many places. But when we do suspect, we will then, make sure that we are able to correct it. But most of the tests that we do, we don't have that kind of a problem. The other issue that becomes a bit of a challenge, which people must be aware of, and we will deal with it in the next few weeks, is that if somebody was said to be positive and later turns out to be negative, we just need to be very certain that it's not a mistake. Sometimes it might be that on the first day, the individual was positive. A few days later or the following day, the person is negative. You might recall many weeks ago, there was a case of a student in Wits who was positive, and then the whole of Wits closed down and so on. The following day, we went to do the test again, and the test was now negative. And when we went through with all the researchers and the virologists and so on into the case, we concluded that, in fact, some people would have been positive, but you can actually switch from positive to negative anytime during the course of the infection, as long as the body has started shedding the virus. So when that happens, someone turns negative, it doesn't mean that the first result was necessarily wrong. It means that they are now positive. In other words, they are now off the viral shedding period. So therefore, it needs the laboratories to be investigated so that we can check that. But it's a mistake that can be corrected. Most of the tests that we've got, as far as we're concerned, we've got a reasonable sense of certainty about them because there are quality assurance mechanisms that we involve ourselves in the laboratories to make sure that the level of positivity is tracked. There's always a way of creating random samples that will track the correctness of the results, which is really not linked to the initial test that was done. So that is a quality assurance that is standard in any pathology laboratory.
Still so many questions and so little time, but government still under pressure to lift the ban on cigarettes. What's your view and your comment regarding this?
Well, my comments about cigarettes is that we are not aware of any health benefit that comes from tobacco smoking. So whatever we can say is one thing that people have got a habit of smoking, but it's not something that we can come to the public and think that, and say that we can express good reasons why people should actually continue smoking. So the first point for me is that we need to discourage smoking at all costs. We need to discourage it because it causes a lot of complications in the body. Most of the cancer of the lung comes from smoking as a major cause. A lot of the cardiovascular problems, heart attacks, and peripheral vasculopathy, where the blood vessels got constricted in the distal part, on the peripheral parts of the body. All of those things can be linked to cigarette. Chronic bronchitis and chest infections get to be more frequent in the situation where people are smoking. The use of nicotine has got its own impact on what we call vasoconstriction, that's the constriction, narrowing of the blood vessels. So heart attacks and such things are associated with that. So there isn't really any reason why I could actually say to the public that you can continue smoking. So if you want to know my views about it, I want to discourage smoking at all costs. That's the only thing I can explain it.
And of course, then the question arises around the science that informs the regulations around the ban of tobacco sales. And would it be correct to say that the view that you've expressed in part speaks to the science that was used to determine that regulation?
Well, you know, the issue of smoking did not arise immediately about the question of you know, whether we want to encourage smoking or not. It arose because the lockdown rules provided for the people going out to purchase essential services, and most of the shops were closed except for essential services. Then the issue arose whether, in fact, we could define, cigarettes as essential services. Of course, it can't be seen as essential services. The fact that people might be having, nicotine addiction does not necessarily make it an essential service. It's just an unfortunate kind of development, as it were. So I really want to focus us on the behavioral change that is going to help us to deal with COVID-19 and not get dragged into an unending discussion about smoking, as though we can actually at some point find an acceptable reason to show benefit on smoking. So I really don't wish to be dragged onto that issue. I think we must focus on the main issue. The main issue is COVID-19. But even the WHO has issued a statement to indicate some of the concerns around smoking, and everybody out there do know that there is a contribution, a negative contribution to morbidity that comes from smoking. And I really don't believe we should be spending a lot of time arguing about that. What we should really be focusing on, what do we do to contain the COVID-19? Rather than having a whole country now fighting about smoking, we should be talking about how do we deal with COVID-19 as a problem. That's a reason now that requires all of us to focus and act, that we shouldn't really be fighting about the containment measures. We should be dealing with the fact that we, each and every one of us, must do something to contain the infection. And this is important because it must be each and every one of us behaving in a way that reduces the spread of the infection. The fact that we should be talking about how to keep a distance between us so that the droplet infection doesn't cause the spread of the infection. How do we make sure that everybody wears a mask and then wear it properly and not put up a mask below the nose or put them on the neck or on the chin? We need to be focusing on that. I think the debate should really not get to the sensational aspect of things where we have to be arguing about things where there's no benefit I can give about tobacco, but there's a benefit on wearing a mask. There's a benefit about distancing. There's a benefit about hand sanitizers. Let's focus our energies on those issues because that's really the kind of behavior we want to see. We're not going to discuss the matter as though we want to encourage more people to be smoking. We're not discussing it that way. We're basically saying the issue is how do we make sure that everybody does something that's going to help us to reduce the spread of COVID-19 as an infection.
Minister, just as well, we don't have much time because, people are talking about their rights in this regard. But I want to push that to the side because, as I said, I have so many more questions and go to schooling. And one of the biggest concerns this week has been about safety of schooling. And is there anything you can advise to allay the fears of teachers and parents and the broader public as grade 7 and 12 gear up to go back to school?
Well, I think we should not continue with the issue of smoking, but there is such a thing as what we call passive smoking, where someone who smokes because they think they've got a right can actually cause a problem for those who don't smoke who are in the proximity. So we can deal with that issue at another time. I think we should really focus on the issue of containment of COVID-19. The question of schooling, I think we must also be honest here to say we are aware that this infection, this outbreak is going to be with us for a much longer time. so that by the end of the year, the COVID-19 will still be with us, and next year, with us. So the question really which we must answer, how do we try and adjust to a new way of living in the presence of COVID-19 as part of our daily reality? We therefore can't close the schools forever. We can't close the factories forever. We have to try and resume normal social activities. We have to start resuming, business activities. We have to now try to get our children back to school so we can start catching up. What are the new ways of containing the infection that will still allow us to be able to, have the schools running, but the infection not spreading? So the only issue that we would need to do is to take the basics of our preventative measures, use those to guide us as we move on. There may be areas where we'll find new things that we learn from one another. Let's be open to do so. There may be areas where we might find that we've got things wrong. Let's correct those and move on. I really want to say that when we talk about going back to school, it is not because we think that it's okay for children to be infected. It can't be correct to say so. The real issue is that we need to start now getting a new way of conducting ourselves so that our schooling can be resumed with all the necessary restrictions and changes in the way we behave. That's going to make it less possible for children to get infected. So we've looked at a number of countries. So if you look at some of the countries in China, in Korea, mainly the ones that were earlier on in the infection, their major strength in reducing the spread of the infection during schooling, during normal business activities, was to focus on distancing or on the use of masks, on hand sanitizers. We are saying let's use all of those tools to get our children back to school. Of course, parents have to be very nervous about it. And we need to really say, if there's any reason why we are concerned, we must then try and work together to try and resolve those issues. I don't believe we'll ever get it right in the first day, but I think as we work together, we should be able to deal with it. And I also think that we must be open about it. Government doesn't have all the solutions, and the parents must make their contributions. It may be a contribution that comes from the community that helps us to deal with it, but the community must all get involved. We do need to get our schools to open. We might find in the process that some people might get infection, but they've been getting infection all along. So all we need is to say where are the risk factors, where we see that this infection is spreading, let's try and contain that, and then make sure that we save others from that because we have learned something from it. That's the only way we can really take the matter forward. We do need to start opening activities, and our people need to understand that they may have those suggestions that can help. And when there are anxieties are everywhere. This is a new infection, and we have seen, challenges in various countries. So it is correct that we'll all be anxious about it. But let's try and work together and find solutions.
Second last question, Minister. When are we expected to see a peak in these COVID-19 infections in South Africa?
The past few weeks, we've been talking about the models, and we initially said we didn't want to bring the issue of models too quickly onto the public debate because the numbers were kind of scattered. You couldn't be sure what you got, and it took a while for some of the models to take the real life data and fit into the models to try and refine them. They might be a little bit more reliable now than they were so many weeks ago. At the beginning, we had 3 scenarios that were put in terms of the peaks. One was a do-nothing scenario, which would have meant that our trajectory would have actually caught up with us early in March and April, and therefore it would have overwhelmed all our services. And we made a point to the public: we will not stop the spread of the infection. We will not get rid of the COVID-19 as a problem. We want to slow down the rate at which it's spreading in the community. That is going to spread. We made it very clear from the start. It will continue. But we didn't want it to spread in such a way that you no longer have space in the hospitals, you don't have nurses, everyone is very sick, and no one can look after one another. That's really what we said at the beginning. Then when we instituted the lockdown, we then said there were two scenarios. Either when we release the lockdown, we can have an early surge, which is what we call a pessimistic scenario. That means the surge is going to happen in June and early part of July, or it would be a later surge, which is now the increase will happen at the end of June to July, August. So let's say from July to August. That means it's an optimistic scenario where we've been able to do everything according to the book so that the spread comes up at a point where we've got enough hospital beds, we've recruited more doctors, more nurses, and therefore we can contain the numbers and treat people well so that they can get discharged from the hospital, and we have lower numbers of people who lose their lives. So those are the three scenarios that we're dealing with. Then we asked the models to give us their preliminary sense. The first model that was brought to my attention actually said the surge is going to come in Gauteng first. Next is going to be KwaZulu-Natal. Third, maybe would then be Western Cape. The epidemic has behaved very differently. What has actually happened is that the surge has come out in the Western Cape earlier than we thought it would come in the rest of the country, and in a pattern that is different to what was initially forecast. So what we are now seeing is that the numbers are increasing in the Western Cape. What, from my own perspective, and this has not been really tabled as a properly calculated pattern, and this we're going to be getting in the next few days when we look and compare the numbers. But what we think is likely to happen now is that you may have a very different kind of pattern where the first part is the Western Cape that will show the surge, and then so June, July, those going to be the heavier days, and probably followed with the Eastern Cape after that. But maybe Eastern Cape together with Gauteng and so on, and maybe KwaZulu-Natal later. That is really pure speculation that I'm saying. You could say so just to give a sense of what might happen. But when we've got the proper models, we'll be able to show what exactly the figures are showing. At this point, we're feeding on all the figures. We're going to be sitting with the modelers to look at what their views are, what's going to be happening. In general terms, we believe that from June, July, we need to make sure that we provide more beds, all the beds in the Western Cape, and additional new beds, more than what we had initially planned. And so that's why, as we sit here, we're going through with the provincial government, that is being worked on now. So we think that the numbers, there'll be enough time to be able to cover those numbers. That's why I raised the question of saying, as a backup, we need to make sure that we can take some of the patients to the private sector to keep that balance. Then we're doing the same kind of work in the Gauteng and Eastern Cape and KwaZulu-Natal, because we think that those are the ones that are going to start showing an increase. So we think that there might be a spread over several months, with one province picking after another and another province picking after another. So that is what is likely to happen, particularly now that everyone is beginning to mix. And if you also look at the way people have conducted themselves, in a number of areas, people are not wearing masks. In some of the areas, the crowds are very strong. And all of those issues will become a factor in how quickly we can see some of the increases and the peaks coming. But I think that from June, July, August, that is going to be part of the times when we see an increasing numbers of people who will be showing the infection. So we really do need to plead with our people that this issue of COVID-19 is serious, that COVID-19 is a bigger threat now than it was when we initiated the lockdown, that when we say we are easing the lockdown, it is not because the numbers have reduced. It is because we have to balance the reality of people having to go back to work, and we have to balance the reality of food relief, the mechanisms where people must actually find their own food instead of waiting for humanitarian support, where we need normal activities, business activities, social activities, schooling, and so on, to be adjusted to the new way of how the country is going to have to face the a situation where we coexist with the virus. We really need everyone to understand the fact that we can't undermine the fact that there's an infection and think that because there was a lockdown and it's been eased, that means COVID-19 is over. There are more cases now than there were when we put the lockdown. When we did the lockdown, we had 927 cases and there was no death. And this time around, there are more people who have lost their lives, and the bulk of them actually lost their lives in the past 2 weeks. Almost more than 50% of the people who have passed away the past 2 weeks or so. More than 50% of the new cases have increased in the past 2 weeks. It does tell us that the numbers are actually rising. So we would like our people to take those numbers seriously, and they must understand that the infection can't behave differently in South Africa than other parts of the world. It's us as South Africans who may behave differently in a way that makes us to slow down the virus, the spread of the virus, not that the virus ever changes the way it behaves. If there is a space for it to spread from one person to the other, it will continue. And therefore, all we need to then do is to understand that it's up to us as people whether we are able to create this distancing, and where we are able to take the infection seriously, and where we're able to respect one another and make sure that I take responsibility for not spreading the infection to others who are not suspecting. We need to also talk to each other because there's a lot of anxiety, people fear, and then some might feel that they have to hide their symptoms and because of the stigma. Basically, what we are saying is as soon as we find out someone needed to be given attention, they do need to come on board and open up so that we can give them support. Running away and hiding or stigmatizing individuals is really not going to help us. So all of those are the issues that we must be discussing every day in our community. And when we do so, it's not because we are trying to listen to what government is saying and it's just about being about just taking instruction. It's not about worrying about the police are going to come and arrest us. It's about us taking responsibility to, protect each other. You protect the next person and you protect yourself. That's the sense of responsibility we must build amongst our own people, as it were. That is the message that is more important. It's not about whether the police are going to see you or whether someone else is going to say something to you about it. We think that community involvement, particularly leadership involvement, is going to be important to remove the stigma so that people must not fear that if I'm exposed, that means that there's something wrong with me. And we must not discriminate against anyone who is found to be positive, because it's a matter of 2 weeks. We deal with the infection. After that, we come back to the society, and that is how we're going to protect each other. That, I think, is a major message that we need to make sure it gets through to all our people.
And then just final question, Dr. Mkhize. And people are very angry about your response regarding smoking and the fact that you say there are no benefits to smoking. And they're saying, can you please tell us what are the benefits of consuming alcohol vis-a-vis the benefits of smoking?
No. I think people shouldn't be angry with the truth. The issue of smoking and alcohol, those issues, I said at the beginning, when this whole issue was started, our focus was not so much on smoking. The issue was not so much on smoking. The issue was that, is it essential services or not? Now, as people are making, making a representation, as they are raising the issue of smoking and issues of alcohol, it's issues other than health that are being considered. So, if anybody wants me to say what are the benefits of alcohol versus smoking, I can't give any benefits. And therefore, the issue is on both instances. It is the issues that relate to considerations largely outside the health issues. So I don't want to be dragged onto having to debate the issue of smoking and alcohol. If you want to get my views, I will only tell you what are the benefits of, what are the benefits to health of smoking and alcohol. And my point is that those two have got deleterious effects on on the health of communities, on the health of individuals. So I don't want to sit here and be sounding like I'm going to promote one against the other. I'm just putting a straight line fact here that says, as doctors, as health professionals, we would discourage any of those. But in the process of all the representations people make, considerations that are being made don't have much to do with the health. They've got to do with a whole lot of other social circumstances, and I will not be dragged into that. And where I sit, our point is that we've got lots of rules about what people should be doing about smoking and so on. But I'm not sitting here to be arguing about. I didn't come here to talk about smoking and alcohol. I came to talk about the COVID-19, and I think we shouldn't sidetrack the issue and make this an issue of smoking and alcohol. The issue here is the COVID-19. Everything we're trying to do is deal with the containment of that infection. Now, I think that even from yourselves as media, let's really focus on the main issue. The main issue is how do we make sure that we encourage healthy lifestyle. If you've got problems of all the comorbidities, whether it's diabetes or whether it's heart failures and so on, those issues are very important to indicate that they can worsen the situation. And similarly, anything that has got an impact on your life, whether it's alcohol, whether it's smoking, those issues, including even what we call sedentary life, where people don't even exercise, because even the issue of obesity is a factor in all of these things. So there's a whole lot of issues that when we talk about comorbidities, we must talk about. And I don't want us to start here separating issues as though this whole campaign we're busy with has only got to do with one thing. It's a whole lot of factors that we must be open to say to our people, these factors will affect, the impact, will have an impact on the infection. And that is it. So I'm not going to be sitting here and having to take to pick a side about smoking and alcohol. That's not my issue. My issue is let's focus on COVID-19. And why should we spend so much time dealing with issues on the side when in fact there is the issue of the virus? I think that we must focus on this discussion in relation to the question of what do we need to do to reduce the spread of the virus. That's really where the real issue must be going. I know it can be quite exciting because everybody wants to raise, a lot of their issues and emotions about that aspect. But the reality is that where we are going to have a problem is when people, put themselves in a situation where we predispose to deterioration of the conditions when somebody contracts the infection. And that's really what we need to encourage everyone to focus on. It must be about containing the COVID-19 as the infection. And if we forget that, it doesn't really matter what we say. At the end of the day, the country will fail to cope with the problem. So let's really focus on the main issue, and that is the infection, and that we can contain that infection. And we need to also make sure that each and every one of us is a partner in the fight against COVID-19. Each and every one of us must protect themselves so that even if they get the infection, they must be able to recover. They must actually make sure that even on those who are on treatment for other diseases must take that treatment, because then it makes them to be under more under control in those diseases, so that when the infection comes, it's easier to manage that. If they're already a complication of other conditions, then of course people will have a problem because the virus complicates that situation. So all we're saying is that all of these factors, be aware of. And the choice is yours, but be aware of it. I will not sit here and say, I make a choice for everyone. People have to make their choices, but when they make choices, they need to understand that some choices will assist in the containment of the infection, other choices will not assist. And really, South Africa we must all focus on what can we do so that we have got fewer people infected, and those who are infected can be treated, and those who are treated can recover, and those who are found to be positive can be isolated so that they don't spread the infection. Then we can cope with the infection. The side issues that we are we're bringing up really must not distract our energy so that we end up thinking that this whole lockdown was about smoking, this whole lockdown was about alcohol, this whole lockdown was about us fighting over those issues. The whole lockdown was to assist the communities to ensure that we can contain the infection. All that we can do to contain the infection remains very, very important. Can we focus on that, please?
Minister, we're going to have to leave it there. Thank you so much for your time. Health Minister Dr. Zweli Mkhize giving us an update on where the country currently stands so far as the COVID-19 infections are concerned, and also some of the other questions regarding returning to schools and fighting this pandemic. All right, it's time now to get a news update. Leanne.